We most often see meniscus injuries associated with ACL injury, and that's the most often meniscus repair that we perform is associated with an ACL. At the time of your ACL injury, there's a screw motion in your knee that typically causes injury to the posterior lateral or back in the back on the outside portion of your knee. You also can have an injury to the inside portion of your meniscus at that time as well, and those are the most often meniscus injuries we see. Sometimes we'll have twisting types of compression injuries in other athletes where they injure their medial meniscus and it can flop into the intercondylar notch area. We call those bucket handle type meniscus injuries. As we age, we typically see other types of meniscus injuries, and we usually call those horizontal in shape because those are the most often we see in that population. And those typically don't necessarily always need a surgery. A lot of times we can rehabilitate around those types of meniscus injuries. But the older population, a lot of times we can recover just with rehabilitation. Whereas the younger ones that occur with our sporting accidents, a lot of times we repair those. With meniscus injuries, if they're older degenerative injuries, we always start with trying to treat the inflammation of the joint and strengthen the muscles around with physical therapy. If there's a piece that's flipping in and out of place and causing a mechanical clunk or catch, we do perform arthroscopic partial meniscectomy and trim the piece that is clicking out of place or moving out of place. We try and be very judicious with partial meniscectomy. We want to leave as much meniscus as we can because that meniscus is increasing surface area, which is important for the health of the joint. With meniscus surgery, they tend to fall into two categories. If we repair a meniscus, we have to go slow, giving it time to heal. So we limit your weight bearing anywhere from 3 weeks out to 6 weeks depending upon the type of meniscus tear. If we have to trim a piece that's flapping and catching, we let you bear weight as tolerated with crutches and get your motion back and your quad back using the crutches and then let you go from there. There's another type of meniscus tear called the root tear. Meniscus are C-shaped in their shape and they anchor in the front and in the back, or we call those the roots because they root down into the bone. If there's a root tear, it's important because the whole piece of meniscus is then not functional, and we repair those routinely. They're important ones to be cognizant of or to know about. You have to be on crutches for 6 weeks with a root tear though.